Hey guys, thank you for checking out this episode. We'd love your support by heading to patreon.com/freshly grounded. It really does make a difference in helping us continue making this content. And if not, no stress. Enjoy. Assalamu alaikum. Welcome to episode 171 of Freshly Grounded. Guys, before we get into it, just a reminder that we're still fundraising to provide emergency packs to those who are unable to get food or leave their house during the coronavirus, and also people in countries where they are vulnerable but also less able to access basic hygiene equipment, and you can donate to that appeal at justgiving.com/freshly grounded COVID-19. And this episode is a very, very interesting one. Episode 171. It's with Dr. Mahfuj Ahmed, who subhanallah, he is a doctor working for the NHS on the front line. Not only is he a doctor working on the front line for NHS, but he also actually had contracted, is that the right word? He had got the coronavirus about a week or two ago. And he talks about both having the coronavirus and also being a doctor during this pandemic. And subhanAllah, today was, this weekend was his, or the weekend that we shot this about 2 days ago. And that weekend was the first weekend he had off in 16 days. And even then, pretty much straight after we shot the episode, he got called in for emergency and ended up having to do a night shift in the hospital. So, just a very inspiring brother. But I'm going to leave it to you guys to listen to it. So this is Freshly Grounded, episode 171. Let's get into it.
And welcome to Freshly Grounded, the brand new podcast by best friends Faisal and Sam.
Huh?
I said welcome to Freshly Grounded,
No, after that bit.
the brand new podcast
And after that bit?
by best friends Faisal and Sam.
Really?
Fine. I'll start with this. How old are you? I don't normally start with that kind of question, but you seem very, very young.
I'm 28.
Oh, okay, fine. And so did you just go straight from kind of studies into medicine? Did you go straight from A-levels into medicine?
Yeah, so I pretty much, as soon as I finished my levels, I went straight into studies. And I think I was studying for about 7 years.
Okay.
In uni, so alhamdulillah.
Alhamdulillah. I was living with some medics at uni, so I could, I saw some of the ups and downs in that. Sometimes you guys seem very, very busy, where it just complete lock off, unsociable, and then other times of the year, you could be almost like very relaxed.
Yeah, I mean, it depends on what year you're in, to be honest.
Okay, fine.
It's a mad journey. I always describe the med school experience as a roller coaster ride. 1 minute you're going up, second minute you're falling down, and you're going up again, and yeah, it's a mad experience.
I seem to have got some lag. Let's see. So for those listening or viewing, we've had our first technical glitch about 20 seconds into this episode. We're just reconnecting with our brother Mahfuj. Assalamu alaikum.
Wa salam. Sorry about that. I don't know what happened. I think someone downstairs switched the Wi-Fi off.
Someone switched Wi-Fi off?
Yeah, I think that's what happened.
Oh,
yeah,
no.
With parents working from home and always home, they kind of do weird things.
Right, I can imagine. So it's all right. We had only just started the discussion anyway, so we were just talking about your journey in med school. You were saying that how you describe it to people normally.
Yeah, so I was just, as I was saying, it's like a roller coaster ride. Sometimes you're going up, and other times you're just falling straight down. Like, especially coming, like, my experiences are quite like, I finished GCSEs, smashed it, alhamdulillah, went to A-levels, first year, I was expected to do great, as in got A stars, etc. But then come results day, I ended up with A, D, E, U. So I was like, nah, that's my medical school dream over. Yeah, so, but alhamdulillah, like the following year, I retook all my AS exams and did my A2 exams at the same time, as it's like, I think this year around they've restarted doing that. And so alhamdulillah, I got my grades, got into med school. First year I did well. Second year, come 2 weeks before my exam, I find out one of my uncle who travelled from UK to Bangladesh, suddenly passed away there. And
Oh man.
on the same day, one of my aunts who lives in Bangladesh passes away as well. So 2 deaths 2 weeks before my exam. And I thought, you know what, do I carry on doing my exams or do I stop? But you know what, if I put in all the effort, Allah will provide. And so I just
Exactly
carried,
right.
so I just carried on with it. Alhamdulillah, I passed that year. Following year, it's like I said, roller coaster ride. Following year, again, it always happens before my exams. 3 weeks before, one of my best friends, like one of my first friends, I refer to him as my first friend, from nursery schools. He got into a car accident, and he became paralyzed waist below. And this was
Subhanallah.
3 weeks before my exam, and I was like, subhanallah, again another test. This time I did the exam again, but this time it wasn't as before, because this time it did get me very emotionally kind of. I was very much struggling, and so I failed that year. I failed all my exams that year, and at the end there was about 3 exams. So I retook those again, and alhamdulillah I passed again. So it's like you just have to keep going, and up until my last exam ever in med school, I didn't pass it straight away. And it was like, it's really like, as in, my last ever practical exam, I missed out by I think 2 or 3 marks. And with that one, it's not a fail, but you just have to kind of do additional stations. And so I did that, and alhamdulillah, like,
Let's hope none of your patients are listening to this episode.
Nah, you know what? I actually did end up going to one of the best deaneries in the country, regardless of how well I did.
Amazing.
I'm telling you, Allah will provide.
Yeah, I'm joking, man.
And Allah provides. And I was like, I was even though I got in through other circumstances, I was working with, say, Oxford and Cambridge graduates. So they're meant to be the best of the best in the country. And despite that, I was on par with them, as in. So it's like initially I was thinking, I'm from London, King's, they're from Oxford, Cambridge. How am I going to compete? But you know what? You just have to put your heart in your work. And I was like, I think one of the only 2 Muslims in that whole cohort of doctors there.
Wow.
So that.
So you ended up graduating, and then did you? I know you have to do. Is it 2 years you have to do as a kind of like a in your like initial phase?
Yes.
After you graduate.
Yeah, exactly. So
and then what did you specialize after that?
So the first 2 years is foundation training. You do various
Right.
rotations. I did that, and then I actually applied for general practice, so to become a GP. But I
Right.
deferred my entry, so I haven't started specializing in general practice yet. And so this year I've been just focusing on frailty, so old people medicine, and I've been going around different parts of the country looking at cardiology, doing various surgical procedures, etc. But coming back to frailty as the main thing. So right now, that's exactly what I'm doing.
Right. And so, wait, first of all, Mahfuj, I can't see you. I don't need to be able to necessarily, but I know I could see you before.
I think it's okay. There we go. Sorry.
That's a lot better. Alhamdulillah. Did you see me the whole time?
Yeah. I think the video
Alhamdulillah.
was off or something.
So right now, you obviously it's like a crazy time and a time where doctors and people working for the NHS are like highlighted to a humongous degree. How have the last few weeks been for you? I want to find out. I want to kind of know how the last few weeks have been for you, and also like how kind of public reaction to NHS workers has been to you as well. But before any of that, what's like really highlighted in the news like today and yesterday? Like the government briefing has been all about it. We've got I think 400,000 gowns just came from Turkey right now, is the PPE situation. So what's your take on the PPE situation? Is it as real as it's being portrayed in the media? And is it affecting you like physically day to day?
So with regards to the PPE situation, so I'll just go back to January, for instance, when the coronavirus issue came about. I've been working on the kind of front line for the NHS for a while now, so working with the frail as soon as they come from, say, we get calls from the ambulance service and they come through, and I'm seeing them firsthand. So initially when the coronavirus situation came about, there was a huge PPE shortage, a huge one, where we knew the best practice was to mask up completely, wear gloves, etc., and even change your clothes. So not wear your normal work clothes. But initially, the trust I was working at, they were like, no, you can't do that. You can't protect yourself because you're going to scare the patients. So this was initially, and I was like, okay, but infection control measures says that you need to protect yourself. By protecting yourselves, you're protecting others from spreading the virus. So initially they're like, nope, you can't wear a mask unless it's a confirmed coronavirus. You can't do it. I'm like, fine, you carry on with your work. So come a few weeks later, with the coronavirus becoming more prevalent and more in the media limelight, there was a huge emphasis on PPE. And that's when the government kind of pushed to get some more in. And I think during that same time, when the kind of China outbreak was going up on full steam ahead, they actually donated PPE masks to them and PPE equipment to China to support them.
Wow.
They didn't take the coronavirus situation too seriously in the UK, but so over time, like every day we go to work and we say they come down and say this is the new NHS guidelines on PPE. So every day is changing, and it's based on how much supply they have. So right now I'm seeing patients who have coronavirus with a surgical mask, not even the ones people are wearing in the streets. You see people wearing mad masks and you're like, wow, can I get one? But surgical masks, which is just a fluid repellent really, so no fluid can penetrate it, and gloves and a plastic apron. That's it. And not even a gown.
You don't have access to them 3M masks that you're seeing online and stuff?
Well, we're not allowed to wear it unless we're doing certain procedures.
So it's not even about having access to it. It's about being aware whether you can wear it on. Like, for example, let's say if you decided to buy your own, right? And you can't take that into your workplace and wear your own.
No, so with the FFP3 masks, or any masks in fact, you can't use it in different places. So in fact, so when you're in, say, a COVID area, that mask belongs in that area. So if you take that mask out and you start wearing it somewhere else, you ultimately got COVID on your mask and you're spreading it everywhere regardless. So you know how like I sometimes see people wearing masks and gloves outside. They bring that glove and mask back to their homes. And some are hanging on the walls, some are just leaving it by bedside. You're bringing whatever that was outside inside. So it's like I don't think there's enough guidance on how to use masks appropriately. So
yeah, I feel like perhaps obviously when things like this happen, people become panicked, and there's different stages of it. And I remember reading an article about 2 days ago about gloves in particular, and just like the danger of wearing gloves more than anything, because you're wearing gloves and therefore you feel protected, and you're touching anything and everything because you're wearing gloves, right? So you touch all door handles, you touch anything that you probably would take more caution in normally, and then you're touching your phone, and then you're bringing those gloves home and you might be re-wearing them, and even if you are throwing them in the bin, you've accumulated a gross amount of bacteria, whereas if you were washing your hands every time you entered somewhere where you can wash your hands, every time you left, every time you came to the house, used hand sanitizer when you were out and about, then you're killing that bacteria as you go along. But what you're doing with gloves is you're collecting it, and then you are using it on your clothes, you are using it on your phone, because it's almost impossible to avoid that, and therefore it seems to be working out more dangerous. Am I right in saying that?
Yeah, that's correct. And another thing is, like, you know, when you wear gloves, you kind of think you have this false impression that you're almost protected. I saw the other day, in fact yesterday, someone wearing plastic gloves actually picking his nose. So it's like, it's not just so it's like, what's the point? So, but otherwise, when you're wearing gloves, it's almost also like you're protecting yourself, but you're happy with spreading the germs to other people. And I know people are trying to protect themselves, but you need to think about others as well. When you wear gloves, you're more likely to spread the virus around. So when you hold a handle outside, or go to a grocery shop, or just even going to a petrol pump. So when you hold any handle with a glove, you're transferring all those germs onto that and leaving it for the other person to come. Because the other person might not have gloves on. And momentarily, they might just hold that car handle and they might want to sneeze and just quickly hold the nose and there we go, it's spread. So it's better to always use hand sanitizers. I know there's a huge shortage, and I've seen a lot of funny things happening in hospital with hand sanitizers, but washing your hands for at least 20 seconds using the guidelines always available. It's available online everywhere, but washing your hands regularly is the best thing you can do. Gloves, yeah, as long as you dispose it as soon as you exit an area. So if you go to the petrol pump, wear new fresh pair. When you leave the petrol pump, dispose them. So as long as you're disposing them, it's fine. But continuously wearing it for other days, there's no point.
How has your how have people been reacting to you? Have you found that people have been treating you or being acting different around you based on the fact that you've been working with the NHS? And the reason I ask, and I don't mean it in a negative way at all, I think that it's amazing that people are generally seeing the value in NHS workers, in doctors, in nurses, in healthcare providers right now. It's obviously something that's been needed for a long time. Again, this morning I was reading an article about how, or last night, about how nurses and doctors have been their kind of demands or requests have been ignored for such a long time by the government, and now all of a sudden the government is approaching those requests that were made months back, years back even, that were being ignored prior. So while we can't cry over spilt milk, it's nice to see that they are being valued both by that side of things, but also by the public. And my sister works alongside the NHS, and she's been telling us stories about how she'll go to like the supermarket and people are literally like giving chocolates and flowers and stuff like that just to like show gratitude. Have you experienced any of that? Or you just mentioned that this has been your first weekend off in 16 days, so I imagine you've literally been going work home.
Yeah, there has been a change in terms of how the kind of public perception of the NHS staff is, and I've experienced just a personal story. When I go to Sainsbury's, I don't like, you know how sometimes they do offer NHS staff to jump the queue, and but I personally feel as though, yeah, that's great, but at the same time you hear stories of people doing that and getting really bad remarks, because you don't like flaunting your NHS badge or your title, etc. You just want to get after you. Like for me, once I get out of work, I'm just myself. I'm not a doctor anymore. I don't like to kind of carry on that title and that kind of occupation. But I have experienced.
Does it help though, because you inevitably you are. I suppose there's one way of looking at it is that people are giving sympathy or rewarding you for the work that you're doing, and therefore you get these privileges. But another way of looking at it, in my opinion, is that you just told me off air that you did just work 16 days straight on the front line, and therefore you genuinely can't. You don't have as much time to be going to the supermarket whenever you please, or to be able to access things quicker, and therefore taking advantage of that is only gonna is helpful to someone like yourself.
Yeah,
right?
I know, it's great. I mean, it's definitely something that is to be taken advantage of for the people on the front line. But I feel as though I've seen this myself. A lot of people are abusing this as well, as in people who aren't working on the front line. They're more working from home, but they've got the NHS title. So there's a lot of abuse going on outside, and even I've heard stories of people getting mugged for the NHS cards. And so it's like, I know the public and everyone's trying to do good and offer free things and make things easier, but at the same time you're putting a lot more people at risk as well. For instance, our sisters who are coming from work late or walking alone with the NHS badge, they're a target now. So it's great, and it's something to be taken advantage of. And you know what? It's nice, as in sometimes occasionally when I go to my local Sainsbury's, the security guy, he's at the door and he knows who I am and where I work. So he's always clapping as soon as I walk in. And so he claps on my way in, and on my way out he claps me and taps me on my back saying, "Great job." Every time, no change, as in no miss. And it's little things like that kind of make it feel as though it's worth it, what you're doing, and that you are being appreciated. Because going back prior to the COVID and coronavirus crisis, the kind of perception from the public has always been, we're paying our taxes for the NHS, you're providing a service for us. So you know how the respect for doctors and nurses, etc., that went out the window. As in, at work, the kind of remarks you hear that doctors are useless, they're not doing anything. You go in for one thing and they don't give you medications, etc., etc. And now it's doctors are amazing, nurses are amazing, they're providing an amazing service. But to be honest, if you think about from like our work ethos and everything we do right now has been the same before as well. Nothing's changed in terms of how hard we're working, because we've always worked hard. And the sincerity in what we do, we've always been sincere with what we do. And practice of medicine itself hasn't changed either. So everything we're doing now, we've done before as well. So in terms of the service from the NHS, it's been the same. But again, because it's obvious now with the COVID that it's taking lives, and people are seeing that the only way to kind of save people who get into hospital is the NHS staff. They're the ones who are going to be providing the treatment, providing the care. And so I think, the perception has changed from that front. There's another kind of thing I always hear this, how the front line are perceived to be heroes. As in, the rhetoric is always, we're at war with the silent killer, the front line are heroes.
Yeah.
And that kind of almost gives the false impression that the NHS staff are superheroes. But really and truly, and they're not afraid. But really and truly, going back to the PPE situation as well, as in I would say every single person working on the front line is afraid. They're scared because they're not superheroes. We're not superheroes. We're not heroes. We're humans. And with inadequate PPE, you fear that you'd catch the virus. And more so, a lot of people live with vulnerable family members as well. And you're worried that you'd spread it. And you're having to work despite all those fears. We, as a first world country, shouldn't be in the situation where we're debating whether we have adequate PPE or not. We, as a country who saw several other countries fall to COVID, should have been more prepared. With, say, PPE, ventilators, etc., we should have been more prepared. But it's because of politicians who politicians who think about all other things, such as economy, etc., before health. And that's what they've done. So they put economy before health initially, and now they've seen that, okay, we can't do that. Now they're putting measures into place. And you know how every Thursday everyone claps for the NHS? Initially it was really nice and it was heartwarming. I'm not gonna lie, I was tearful when the first time it happened. I was like, wow, people are supporting us. And actually, when the first one happened, I actually had coronavirus myself. So I caught it.
Oh, you've had coronavirus?
Yeah, so this was right in the early stages. I think it was actually about 3-4 weeks ago I had it. And I was completely out for 7 days straight. But the kind of guideline says that, the NHS guidelines is if you're symptom free after 7 days, you need to get back to work. So I was back to work because I wasn't coughing.
Is that as a doctor or is that everyone?
NHS frontline, as in if you're working with patients. Because what's happening is, because a lot of people, we don't see this and you don't hear it, but a lot of people are catching the virus. It might be mild symptoms or moderate, but a lot of healthcare workers are catching the virus. So if all the healthcare workers are at home recovering, who's at the front line?
I've heard about this.
So you need more people there in order to serve the kind of public. And so there is a push for you to come back quicker and as soon as you can. We don't have the luxuries of, say, politicians who, once they catch the virus, they can take time out for months. It's not the same, as in we have to go straight back in there. And you know what? Deep down inside, when I had it I was out for 7 days, stuck in a room, self-isolating. And as soon as I got a bit of energy back and my symptoms were better, I wanted to go back, because when you work with a team for a long time, they become another part of your family. And when you know that family is going to struggle as well without one member of the team, you feel obliged to go back and because you're part of, say, these WhatsApp groups, etc., and you can see the struggle on the front line, and just being there and doing what you can is better than being at home, in my view. So yeah, you just want to go back and yes, sir.
Sorry. How were your symptoms when you had it, and did it kind of spread in your household as well?
So the symptoms I had was I woke up and I was praying, and my legs felt weak, as in I couldn't bend down. It just felt like I was squatting all the day before, like the entire day. My legs were completely gone, and I thought, you know what, you sometimes you're in denial about things when you fully well know it's that. So I was in denial about it that day. I was like, you know what, it's nothing. It's probably I've been walking all day. I just put it down to that. Come towards the end of that same day, I started having fevers. I was driving back from work, and the fever's up and down, up and down. And I was like, what's going on here? Is in my car heating, whatnot? By the time I got home, I was completely flat out. So I realized what it was, and I went straight to my room. Like, my parents were like, where are you going? I'm like, not right now, I'll call you. So I went straight to my room, and thankfully I've got the top floor in my own bathroom, so it's all right, so I can self-isolate properly. So I just called them back, and I said, look, no one come upstairs. I think I've got the virus. So, because I realized quite early on what I had, I was able to self-isolate and stay away from my family members. And alhamdulillah, they didn't catch the virus. So it didn't spread. They used to bring me food and leave it by the staircase, and I used halfway there, and with a mask and gloves, and I used to go and pick it up and have it and do the same thing. So I had zero contact. I was FaceTiming my parents in my own house from upstairs, and it was, as you can imagine, everyone was very much worried about what could potentially happen. And when you fall ill and you go to your mother and you want to go to your mum, however old you are, you'll always want your mum to be there. You don't have that. And during the virus itself, I know I didn't have to go hospital for it, but there was a point during the kind of virus itself, I was thinking about writing my will, with something I've been putting off. So I was thinking about death a lot. I was thinking, is this my time? Because a lot of people are going, and young and old. And my immune system must have been really down at that point, because when you overwork, your immune system does take a hit as well. So I was thinking, maybe this is my time, because I had shortness of breath. I couldn't speak properly. I couldn't get out of bed, because every time I lifted my head, I felt like that was it, I'm suffocating. So you think about death a lot. And at that moment, you want your family members around you. And of course, you don't have that. So you're pretty much all alone. However much you can talk to them, you want to have their presence next to them as well. And yeah, that was tough. But alhamdulillah, within 7-8 days, I was better, symptom-free, back to work. Alhamdulillah, family were okay as well. And inshallah, it stays that way, because you don't know what's going to happen in the future in terms of the virus, whether you become immune or not.
Yeah, I was going to say that's kind of one of the hot topics as well right now, with not knowing whether you become immune once you've had it and stuff. Alhamdulillah, you're a lot better. I'm very, very happy to hear that. I didn't know that you had had the virus as well. And alhamdulillah, it's amazing to see that you were able to shield yourself even to those living in your own house, man. I'm conscious of time, because I know that A, it's one of your only days off, and B, we're trying to keep these episodes short anyway. So I did want to shift the topic slightly, though I feel like I could talk to you about the virus all day long, considering that you've both had it and you're on the front line helping others. But I saw a post recently on Instagram, and it really affected me, man. And again, this is kind of completely off topic to the virus, but knowing that you are a big supporter of this work, I do want to ask you. I want to ask you about it. And so it's about a charity called Al Ishara, and I first came across Al Ishara, I want to say like 3 years ago. I was introduced to it by a brother who I think was like a volunteer. I had never worked with them. I still haven't worked with them. but I really fell in love with it, and the reason I fell in love with it is because Al Ishara, and I'm sure you can expand more on what they do, but they focus on providing Islamic content or translating Islamic content to people who are deaf. And in my family, I have a cousin who is he's not completely deaf, although he did go to a boarding school for people who are deaf, and he has to wear hearing aids. And with his hearing aids, he can both using lip reading and hearing slightly, he can make out kind of the conversation. Alhamdulillah, he's managed to live pretty much a completely normal life, in that it hasn't affected his life to the point of, affected jobs or marriage and stuff like that. Alhamdulillah. However, it really got me thinking that, subhanallah, when our iman feels low generally, which everybody goes through, because we even hear about ahadith about people's iman feeling low, about the time from the people, from the salaf and the tabi'in and the companions in general. When our iman feels low, we can watch a YouTube video, or we can speak to our teacher, or we've got so many avenues, right, that we can go to get an iman booster. But it got me thinking when I heard about Al-Ishara, that what do people who are deaf do? Because they don't necessarily have as much access to those means, right? And so then I realized how important the work of Al-Ishara is. And so this was all like 3 or 4 years ago, and I've always kind of been a silent supporter of the charity. And then when recently I heard about the fact that being such a small charity, they're in a real tough spot. They mentioned that it could be within the next 3 months that they completely eradicated, and that hit me hard, because I feel like if they are eradicated, who is providing that level of translation, that level of support to deaf people? So I'm intrigued to know about how you started finding out about them and supporting them. Was it to do with your journey in medicine? Was it like a kind of like a clear link like that? And can you maybe shed some light on what is currently happening with them guys right now?
Yeah, so with Al-Ishara, I was made aware of the charity in 2011. So this was when I was a second year medical student. And that was by a teacher, my GCSE IT teacher, who I was in contact with. He joined the charity because I think it was in 2011, it was again a very similar situation to now, at the brink of closure. And so we joined then, and I heard about it. And when my teacher told me about this community, the deaf and hard of hearing community, I felt ashamed of myself, because I've never considered them, never even thought about whether they exist, how they get the content. You just live in a fantasy world thinking, if I've got it, everyone's got it. If I've got access to Islam, everyone's got access to Islam. Islam's been around for so many years in the UK. Someone must have done it. But then at that point I realised there is nothing out there. There is no online content for them. So that's when I joined Al-Ishara as a volunteer. And I've been with them since. And some of the services they've been providing is immense, and it's pioneering, because everything we do, no one's done before, and we're the first. And for instance, the Friday khutbah in East London Masjid is translated to British Sign Language for the deaf community, and now it's aired live as well on different platforms. Whenever they get guest speakers in, for instance, when Ustad Numan Ali Khan came, we provided a BSL translation, even if it's for 1 or 2 people. That's 1 or 2 people who have access to Islam and access to that immense knowledge. And we have the deaf and hard of hearing children's Islamic school. So that's the one that's really close to my heart, as in we're educating the next generation of Muslim scholars who are deaf and hard of hearing. So the whole purpose of Al-Ishara is we train so many and teach so many of the youth that they become scholars in their own fields, and they pass on that knowledge to the extent where Al-Ishara no longer needs to exist. As in, we want all the deaf children to be able to gain that knowledge from their parents. So there's 3 branches right now, one in Luton, one in Redbridge, and one in Tower Hamlets. We also have our weekly adults classes as well, providing Islamic knowledge to adults, touching on different topics. Going back to that, I remember this is a story that really kind of got to me and made me think about my deen as well. It was a adults class where a deaf client, he brought his child with him. He was about 10 or 11. So after the kind of lecture finished, the sheikh asked everyone, does anyone have any questions? This 10-year-old boy put up his hand and asked the sheikh, how do I get closer to Allah? This is a 10-year-old boy asking a question who had no prior access to Islam. This is probably the first time he heard about Allah through sign language. And the first question he asked was, how do I get closer to him? How many of us 10-year-olds ever ask that question or even think about it? Even as adults, how many times do we think about it? So that I was thinking, wow, like this is a community who have not had much access to Islam. And now they've had some golden nuggets, I like to call them, received some golden nuggets of knowledge. They want to know more. They really, really want to know more. So at that point, we kind of expanded our services even further. We started our deaf youth club. So we were bringing the deaf youth, come together, get together, teach them about a few things. And then we also started a deaf marriage service, which is very much needed as well in the community. In the back of our mind, our biggest project was the translation of the Quran into British Sign Language. But you don't want to start something unless you know you can do it with ihsan and to the best of your ability. And that's an ethos that we like to carry throughout Al-Ishara, as in we don't start things unless we know we can do it properly. So, alhamdulillah, about 2 years ago, we started the translation of the Quran into British Sign Language. Again, that concept itself of having the Quran in British Sign Language, you think it already exists because you've got all different languages. Even the Braille Quran, you've got it. But what about the deaf population? It was surprising to me to know that it never existed, as in the direct translation from the Quran to British Sign Language did not exist until we kind of took that step. Another misconception is that with British Sign Language itself, that it's a direct translation from English. It's not. It's a language in its own right. So if you were to translate British Sign Language is a language in its own right. And within British Sign Language, you have accents as well. So I remember having an event, we had people from all over the UK coming, some from Bradford, Liverpool, UK, even within UK, East London, etc. They were all signing differently. So they all have accents within the language. So it's a total language in its own right. And it's a visual language, so you can't write it down.
Wow.
So there's so much about it and you realize, wow, it's not as easy as it looks. So even with the Quran, it took us about 1.5 years to complete one para of the Quran. And it took a lot of effort, and the team itself consists of 6 experts in their fields. So it's a very rigorous process, and you want it that way because you want that trust that the Quran itself is being translated to the best of our ability, because it is the word of Allah and you don't want to mess with that. So,
of course.
So it's...
Have you managed to pick up any sign language yourself?
That's the thing. So I've picked up a few words, and because of my commitments with, say, work and everything, and my kind of... I work in the marketing and generally the marketing side of Al-Ishara. So my focus has always been to keep the charity alive and keep the charity moving forward. So I've never really had the opportunity to sit down and go to a course, because I used to balance my kind of uni work, then work, and then Al-Ishara all in the day. So I used to go to uni, finish by 3, go work for 2 hours or so, do my graphic design, etc., and then come straight into Al-Ishara from 7 to 9, work with the fundraising team. And the fundraising team was me and another guy. So it's like we used to bang out a few hours, then go home and back to school. They too do the same thing. So both of us actually, we never had the opportunity to go and pick up the language. And that's one of the regrets I do have. But at the same time, I feel as though, having been with the charity for nearly 10 years now, I know most of the deaf community and they know me as well. And I'm able to kind of sit with them and have a conversation it's not official sign language that I use, but I've picked up a few words and this and that and just put it together, and they make an effort as well with the lip reading, etc. And I can hold a convo. And for me, that is all I need.
That's amazing.
Alhamdulillah, yeah.
Have you had deaf patients come into the hospitals and stuff, and I imagine that feels quite fulfilling because you obviously have a connection with the community outside of work.
Yeah, I had that in my first year as a doctor, where everyone was like, "Oh, this man's crazy. He doesn't talk to. He's not able to talk. He's got these issues, etc." And I just checked his file, and the first thing it says he's deaf. And I was like, you know what? He's not. I don't think he is crazy. Someone just needs to use sign language and just use signs that he's aware of. So I went there, and the first thing I said was sorry, which is this, sorry, and you saw the smile on his face, the instant connection. Then I started using a few more words, and I started signing a few things, and at the end, all he wanted to know was what medications he's having. It's a simple question. He just wanted to know what medication he's been given. He wanted to know the names, because with once
That's so sad, man.
Yeah. It's sad, but so then I realized there is a problem there in that hospital itself. So we came up with the idea of having pictures of medicine. So, and as soon as a deaf patient comes in, you use pictures and cards and stuff like that. So alhamdulillah, it's because of my experiences with Al Ishara and having communicated with the deaf community, I was able to kind of pick up that this is what's needed. So it was very fulfilling for sure. But there is a great need in the healthcare sector for them.
So just before we finish up, how dire is the situation right now? That because all I've seen is that one post, but what's the situation right now with, they were saying that because of the effect that the coronavirus has had on all businesses and all industries, Ramadan is normally the busy period for them, and it's not looking positive. What's the situation? That's all I pretty much know. Yeah,
so as you're aware, with Muslim charities, the biggest fundraising period is Ramadan, where you get a bulk of your donations. And Al Ishara, we've always had a huge bulk of the donations coming through Ramadan. And we raise enough to get us by to the end of the next year. Because sadly the situation is that when it comes to donating towards causes, people haven't got that connection with the deaf community yet, and they don't fully understand the need for our services. So when it comes to donating for say in Syria compared to donating to the UK for this service, you'd want to get your heart's more inclined towards donating to Syria. I'm not saying pick one or the other, but I'm just saying you're more inclined. And personally, that's sometimes what happens with me as well. You see the situation abroad and you want to support the brothers and sisters there because it's more life and death compared to knowledge. So our donations itself will kind of take a hit because we're not able to do our events, we're not able to go up on the streets and really engage with people and tell them about the charity. And so we're foreseeing that in the next 2-3 months that the charity might not have enough funds to run. So that is the situation. So the charity put an appeal up early on because it's better to be proactive than reactive. We'd rather know what state we're going to be in the next 3 months and act based on that as opposed to waiting for the 3 months and then saying we're closing, because we really, really don't want this service to close because there's such a huge need for it. Because like you said earlier on, that if this charity doesn't exist, who will provide this deaf service? Simple.
I agree, man. It's such a shame, and I really pray that that we're able to kind of together as a community, including us, be able to support what Al Ishara are doing, so that it doesn't stop, man, because the work is needed, and we need to come together as a community and think about others. And I think this is the time where we do think about others, and we do think, okay, I'm not perhaps going through this, but there are people who are, and sometimes we're not affected by something until we go through it or someone close to us does. But inshallah, this podcast and this episode will be a reminder to that. Mahfouz, I just want to say a massive jazakallahu khair for your time. I really, really do appreciate it. I know that you're an incredibly busy person, and this has been your first weekend off in a very long time, and so you know, I want you to be able to rest and spend time with your family. Is anything you kind of just wanted to end on before you do leave?
Firstly, Jazakallah khair for having me on your podcast. I've been following you guys for a year, like since you started, so you're doing amazing stuff. So may Allah give you more success.
I had no idea.
I mean, I've been following you for a while, alhamdulillah. And also my parting words, as you say, would be that follow Al Ishara and support the work that they do. I mean, it's a service that's very much needed, and just look into it. Even if you don't donate, share the word. And if you have deaf or hard of hearing family members, bring them to us and let us be introduced to them so we can support them as well. And the second bit with the COVID virus, you know, this virus has come, and whatever comes will go away eventually as well. Remember that during this period, how close you are with your family members, being self-isolated, you've spent so much more time with your family. Once this virus is over and gone, don't stop spending time with your family, because they're the people who appreciate the most.
Oh man, I'm sure people don't know this, but this is the first time you and I have met, other than one phone call which lasted maybe 6 minutes or less.
Not even
kind of
that.
just like shouting instructions at me like, bro, we need to get on an episode together. And so it's been absolutely lovely to meet you properly for the first time, and I pray that
likewise.
inshallah we're able to meet in person, and and that we can remain in touch. So please do, you have my number now, so please do stay in touch.
Definitely,
and,
likewise, bro.
Anything that we can do to help.
Likewise, brother. It's been a pleasure meeting you.
You just stay there, inshallah, so I can kind of instruct you on how to kind of get that content over and stuff. But in the meantime, jazakallah khair to everyone watching and listening, and inshallah we will see you again perhaps tomorrow for another episode. Jazakallah khair. Assalamu alaikum.